Hello, everyone. Thank you for joining us today. We're joined by Jonathan presenting over performance improvement, the integration of quality and finance. And we've been really looking forward to this presentation, kind of looping most of the work we do together with both the areas of quality and finance and just the important role and how they're not separate topics. And so, with that said, Jonathan, I'll turn it over to you. If you're watching this recording and have any questions at all, please feel free to reach out to me. With that said, Jonathan, I'll turn it over to you.
Thanks, Laura, and excited to present on this information today. As we talk about the convergence of quality and finance, it's really under the understanding that in today's times, we have to come to the realization that quality has a direct impact on financial performance, and financial performance has a direct impact on what we can afford to do from a quality standpoint. Gone are the days of operating as siloed entities and being able to focus just on finance and having our clinical staff focus on just on quality improvement. We have to start to realize that as we look forward, we have to start that realization and we have to start bridging those two areas. Now, the conversation today is really going to focus on how we can start to operationalize those different components. What are different ways that we can look at converging quality and finance to really start having them focus on broader performance improvement initiatives as a way to drive things going forward? Now, when we talk about the rural environment experiences barriers and opportunities that are oftentimes not relevant to our larger urban counterparts. Now, when we look at the fact that 1 in 5 Americans live in rural communities, and we start to focus on the fact that oftentimes in those rural communities, we do not have the same access to healthcare services that are available in many of those urban counterparts. Now, what are some of the barriers we experience? Now, our providers are oftentimes having to wear multiple hats and not only focus just on their specialization, but also having to dabble in different areas because they're not able to get direct access to other type of providers. In addition to that, not only are our providers experiencing that, but also our staff that are doing, whether it's financial functions or clinical functions or whatever the case may be, they oftentimes have to wear those multiple hats also. Now, for me as a former CFO, I also remember that I wasn't only just focusing on the financial operations of the organization. I also had an impact on the IT aspect. I was also focusing on different types of performance improvement initiatives. Now, when we start to focus on all of these additional areas, we have to realize that they present many opportunities that we can leverage as a means to improve better patient outcomes or financial performance going forward. It is oftentimes the inefficiencies within the rural market that allows us to create many of these opportunities or leverage these opportunities again to improve our position going forward. Now, what is the current landscape that we're experiencing? All of us have experienced staffing shortages or revenue cycle issues or policy changes, cost increases, out migration, whatever the case may be. What we have to start to realize is we have to start to address the issues and the processes and the procedures and the performance itself as opposed to just trying to remediate those fire to fire type issues going forward. Again, so we have to start focusing on actual performance and process improvement as a means to drive things going forward. That is the only way that we're going to be able to actually drive performance improvement and start to leverage these efficiencies going forward. Now, when we talk about that broad performance improvement model or that broad performance model, everything ties back to the value to the community. Now, when we drill down a little bit further, we have strategy, which should be really driving our broad direction, how we engage people, and how we start to push the services going forward. And then we have the other aspect, which is the operations. And that should be to things done to actually achieve or to realize the strategy that we're looking to accomplish. Now, when we drill down into the operations, it's segmented into financial and quality. Now, again, when we talk about the healthcare industry, this is one of the most segmented industries out there. Oftentimes, clinical doesn't talk to finance, and administration doesn't talk to other staff, doctors don't talk to nurses, and so forth. The question is do we have any of these silos prevalent within your organization? Now, if we do have the siloing within our organization, how can we start to remediate these issues as a way to start to realize performance improvement opportunities? Now, I can't tell you how many organizations I've gone into where one side of the coin doesn't talk to the other side. And as they start driving performance improvement initiatives, oftentimes there's redundancies or there's actually contradictory goals as a means to drive certain performance improvement opportunities going forward. Now, because we're wearing multiple hats within a rural environment, we have to look at ways to leverage those operational efficiencies as a way to drive performance improvement. We don't have the latitude of having multiple people focus on a single functional area as a way to drive performance improvement going forward. We have to look at different ways to actually drive these initiatives. Now, when we talk about performance improvement opportunities, I've always segmented into four main components: operating, financial, value, and market. Now, anytime we talk about these different functional areas, it's under the realization that oftentimes our finance staff works on finance, our clinical staff focuses on market and value, maybe our COO focuses on operating. What we have to start to realize as we start to bridge the gap in converging quality and finance is we have to realize that people outside of those core functional areas oftentimes has a direct impact on the metrics or those performance improvement initiatives. Now, a perfect example of this that I can use is, let's look at something similar to net days AR. Now, every hospital has a goal of a 45 days net AR or some other variation of that goal. Now, if I were to talk to the organization and say who all is involved in actually tracking, monitoring, and driving performance improvement relative to net days AR, oftentimes it's the CFO, a rev cycle director, some other business office staff, a coder, and so forth. The problem is that how much of the actual revenue cycle process do those staff actually control, or can they effectuate change on? And I'll ask them, do you have a physician on that group? Do you have your CNO? Do you have a pharmacist? Do you have your registration staff? And oftentimes those individuals are not involved in the remediation efforts of net days AR. And the problem is that there's no amount of people that you can bring in to remediate the issues if you are not actually pulling in those staff that are directly responsible for completing those functions on the front end. For instance, if we have an issue with provider documentation and we're not including any of the providers as a part of that revenue cycle collective, how are we going to be able to drive performance improvement if we're not including the very people, or we're not having those people accountable to the performance of that metric going forward? The same thing if we start looking on some quality aspects. Now, again, if we're looking at hiring certain quality staff as a way to drive patient outcomes or improve outcomes, and we're not including financial staff or the CFO, we're having conversations around budgeting, how likely are we to be able to bring in additional staff if we're not including the CFO to gain a functional understanding of why those staff are needed and what it can do to actually drive outcomes going forward? Now, what is the evolution of improvement models? Now, if we go back in time and we go back to the 80s to the 90s, it was very much segmented into three distinct areas. We had quality improvement, revenue cycle, and finance. And there wasn't a lot of overlaps across those different areas. Once we got to the 90s through 2000, there wasn't really any change. We switched from quality assurance to quality improvement, but it was still revenue cycle and finance focusing on budget and statements. It wasn't until we got to the year 2000 through 2015 that we really saw our first major merging of those functional areas. And we saw revenue cycle and finance come together under the realization that revenue cycle had a direct impact on cash flow, financial position, and performance metrics in those areas. But again, performance improvement under the quality aspect was still very much segmented. It wasn't until today's times, and whether we go back to 2017 or even if we focus in today's times, our top performing organizations have come to the realization that in today's times, quality has a direct impact on finance and finance has a direct impact on quality. And they've come together under a single performance improvement initiative as a way to drive things going forward. They have pulled together our CNO, our CFO, our CMO, that whole collective of different executives and support staff throughout the organization to focus on performance improvement initiatives. Only then are they able to leverage efficiencies and operational improvement as a way to drive things going forward. Now, when we're developing and implementing a plan, there's really five main characteristics of an improvement plan. And again, I'm not going to step through each of these additional steps, But what we really have to look at is we have to come up with a process and a means to start to drive those performance improvement initiatives. And again, we can't view it only at that 50,000 foot view. We have to focus on the linkages across the different departments as a means to drive these initiatives. Now, oftentimes, one of the most overlooked areas relative to performance improvement is really leveraging the data available to us within our organization and using that to drive those initiatives going forward. Now, again, when we're talking about the leveraging of that data going forward, it's important to leverage the data we have within our own organization. But one of the key things that we have to do is benchmark ourselves to external organizations. Only through the benchmarking of information can we truly determine whether or not we are successful as an organization. Again, if we have a performance improvement and metric to say, let's go from 10 days DNFB down to 9 days, again, we may achieve that goal within the individual year, but if the industry benchmark across all entities is, let's say, 5 days DNFB, even though we went from 10 days to 9 days, we are still in one of the worst performing organizations when we benchmark ourselves to other entities. So, again, it's important that as we're developing this improvement plan, we define the data and we look at different ways we can benchmark ourselves. Now, anytime we also come up with an improvement plan, there's a couple key things that we have to include inside that plan. The first thing is we have to identify very clearly the goal that we are trying to accomplish. The next key thing is whatever we are defining as that goal, we have to be able to measure that goal that we are looking at accomplishing. Again, if we can't measure it, how are we truly able to determine whether or not we are succeeding within that individual goal? And then the last major thing that we have to determine is we have to set a date for when we want to accomplish that goal. Again, we can't establish an open ended date where things just remain in perpetuity. We have to set a specific target for when we want to accomplish that goal going forward. These are the key things that when we're establishing an improvement plan that we really have to look at going forward. Now, what are other parts of that program structure? Again, we clearly have to identify roles. One of the most important things that we have to look at anytime we want to look at the convergence of a performance improvement plan is a structure of accountability. Now, when we look at different levels of accountability, I always like to say there's three main types of accountability. You have no accountability, you have forced accountability, and you have a culture of accountability. Now, oftentimes organizations will dabble somewhere between no accountability to forced accountability. Now, what forced accountability is that's where we pass down certain directives and we're saying, you are going to achieve this, you are going to do that. But the staff have no broad ownership into how they are actually trying to perform. In a culture of accountability, we establish goals and expectations, but each individual understands the relevance and the importance that they play in those broader initiatives, and they take it upon themselves to actually try to achieve those different objectives. Again, somebody is not stepping down to them as a CFO or CEO or whatever the case may be and forcing them to try to achieve some type of objective. Again, in a culture of accountability, you very much remove the punitive nature of many of these things and you move more towards an environment where you can actually start to transcend and start to achieve and be high performing. In addition to that, we also have to identify approaches to process improvement. We have to start to integrate quality principles into our policies and procedures. And most importantly, we really have to identify the educational needs as a way to start to drive staff initiatives and start to engage our staff going forward. Now, when we look at the different influences of program effectiveness, again, how we define our goals and really the expectations that we set on our organization will go a long ways towards dictating how we perform and what are those additional initiatives going forward. Again, if we don't try to look at the influences on program effectiveness, we can tend to overlook certain critical things that may have a direct impact on how well we perform going forward. So again, we have to look at all of these additional things. Again, one of the key things is leveraging the data that we have available to drive initiatives going forward. Now, what are some of the pros and cons of the current structures? And again, the cons, the current structure being finance doing finance stuff and clinical staff doing clinical staff. Now, some of the pros or some of the advantages of the current structure is it's easier for staff to learn. Again, finance staff don't have to learn about clinical functions. Clinical staff don't have to worry about financial metrics and P&Ls and all of these additional things. It does not require people to focus outside of their core functions. So again, people can very much get granular into their areas and do not have to dabble in many of those other areas. What are some of the disadvantages? Again, when we don't overlap or we don't pull in critical people that have a direct impact on a certain functional area, it can lead to too many meetings. I can't tell you, going back and looking at my time as an operator, how many meetings that I attended that could have been sent through an email or could have actually been dissolved from a committee perspective. Oftentimes, the same people are involved in the same number of meetings. There's lack of transparency, there's variation in expectations. Again, there's also limited involvement across the organization. All of these create an environment of inefficiencies when we're looking at how we can actually sustain things going forward. Now, when we talk about laying the foundation of the different roles and responsibilities, it's important to note that each of the different functional areas, when we're talking about the convergence of quality and finance, has different areas of importance and different structural measures that they should be looking at. Now, when we talk about our board of directors, they're very much responsible for broad accountability across the organization, again, as that governing entity. Our executive management team, very much responsible for the coordination. Again, whether you're a CFO, CNO, CEO, you cannot drive all of the day-to-day responsibilities across the entire hospital or across a clinic. So you very much have to coordinate with other department heads and leads and individuals as a way to drive broader performance improvement initiatives. Our medical executive committee is very much driven on guidance. Again, what can we establish? What are the services we can provide? All of those things. Our performance improvement collective or collaborative is very much responsible for the effectiveness monitoring. Now, when we look at this going forward, everything flows through that performance improvement committee. Again, looking at how we can drive performance improvement. They are the ones that are responsible for tracking broader performance improvement at the organization and ensuring that we are achieving our broader objectives. We have our reporting entities, which are very much focused on the improvement. Again, those are the ones that are going to be drilling into the actual improvement efforts and so forth. And then we have our committees that we establish as a way for organization and compliance within our individual hospital. Now, when we look at our governance and management committees, we have our board of directors, again, very much focused on driving the broad organizational position. They have a balanced scorecard framework. They're focused on performance improvement process and so forth. Our executive management team, again, they are the ones that are evaluating the performance of the hospital relative to the strategy. They need to interpret the strategy and they need to establish parameters within a hospital to ensure the organization is actually achieving that broader strategy. And then we have our MEC, that Medical Executive Committee, which is looking at clinical processes and outcomes and so forth. Now, when we talk about that performance improvement collective, it's important to note that this group should not be chaired by the CEO. This is an entity or a unit that comes together that's inclusive of the COO, CNO, and the CFO, really as co-directors coming together as a way to drive performance improvement. Now, when we look at these areas, again, each one of these different entities or these different units is not responsible to report information every single month. It's leveraging a different type of cadence when we're pulling together our different department heads to realize that a lot of times the information that's being reported does not change that much on a month-to-month basis. So by having some type of structure and distribution of when information is being reported allows us to drill down much more granularly into different areas to start driving that performance improvement going forward. Now, at the end of the day, again, the PIEC is the one that's responsible for driving and ensuring the accountable structure relative to the different metrics within the organization. Now, when we look at different reporting entities, again, all of your reporting entities are broken down into your major and non-major departments. Now, when we think of those major departments, it's your emergency department, med surg, and all of those additional areas. Our non-major are imaging, rehab, and so forth. As we're selecting these different metrics and we're establishing benchmarking parameters, we want to ensure that we're selecting things that are achievable within an improvement effort. Now, what's most important relative to this is the action planning or the actual steps taken to achieve or to try to pursue these different objectives. Again, when we're looking at performance improvement initiatives, if we do not establish goals and action plans to achieve outcomes, we are not actually driving performance improvement initiatives. Now, when we look at all of these additional improvement opportunities, we also have to realize that we have to evaluate each of our different strategic goals or performance improvement initiatives. Not everything is going to have the same weighting of importance. Now, as we look across these different areas and we start to identify the different performance improvement initiatives, we will realize that some things, again, have greater importance when compared to others. As we start looking at these additional areas, it helps us rank the ones of the strategic importance as to where we should be dedicating most efforts. Now, again, it's not to say that those ones that aren't ranked as high aren't as important or aren't important at all. It's just allowing us to focus and establish expectations as to those type of things that have a greater impact on either financial performance, patient outcomes, or different areas to that degree. Now, what are the reporting entity responsibilities? Now, when we talk about the reporting entity responsibilities, they have their indicator selection, they have target setting, benchmarking, and action planning. Now, the reporting entities are those groups that are actually going to be driving a lot of these initiatives going forward. Again, they're not just reporting information back to the performance improvement collective. These are the people that are actually responsible for the day to day functional responsibilities of driving these things going forward. Now, as we talk about that convergence also, and we talk about different areas, it's important that we select indicators that allows us to converge those two different areas. Now, when we talk about different ways that we can accomplish this, let's select a metric that actually has direct impact on financial performance and clinical outcomes. For instance, maybe if we have a rural health clinic, we want to focus on patient throughput or visits per FTE within the clinic. Now, again, this is not something that we can directly tie to financial performance. But again, if we're able to increase the number of visits that each provider sees within the clinic, we know that we're going to improve our reimbursements, we're going to improve our net position, and so forth. On the clinical side, if we're able to increase the number of visits at each provider sees, we're going to reduce the amount of time that patients need to wait for visits, and oftentimes we may improve outcomes because patients aren't having to wait for getting care. Again, let's look at selecting things that allows us to merge these two different areas. Now, when we look at the flow of data and the flow of information, all data flows into that performance improvement group. We have to leverage this group as a way to drive these initiatives going forward. Again, there needs to be a single unit within the organization that is responsible for those broader performance improvement initiatives. Again, we can no longer operate in a siloed environment where finance is doing finance stuff and clinical is doing clinical stuff. Now, when we talk about that quarterly reporting, one of the least efficient things that I've seen done in a hospital is you get together as a department head group or you get together as a leadership team and you go around the table and every single person talks about it, something at that 50,000-foot view that really doesn't let you address anything. Or you have the how are things going in your department? Everybody just says everything is going well. By changing the actual distribution of when people are meeting and when people are actually presenting information allows you to get more granular into the actual metrics. So again, if in month one you're only focusing on, say, imaging and laboratory and emergency department, it allows you to get more granular and talk about the actual processes impacting things versus just talking about the actual metric at that very 50,000-foot view. So again, it allows us to get more granular in those different areas. The last area which is really effective in these performance improvement initiatives is really the establishment of task force groups. Now, oftentimes in healthcare entities, we will convene a committee that comes together to focus on some type of initiative. And then unfortunately what happens is that even when the committee resolves all of the issues that they were really tasked to complete, that committee continues to meet going forward. And it's just another meeting that is built onto your calendar. The purpose of a task force group is to pull together specific people as, again, under that PIEC group to identify and to solve a specific issue that that hospital is experiencing at that moment. Again, clear accountabilities, expectations. It has a specific time parameters and dedicated staff. Now the key is once that group identifies and resolves the issue that they were originally convened to accomplish, you disband that group going forward and again pull them together in some other area. But the goal is to identify specific areas going forward. Now, again, when we talk about the performance improvement initiative and we talk about these different opportunities, the goal is to identify and realize that we must converge quality and finance into a single performance improvement initiative. We can no longer continue to operate in a siloed entity and continue to operate like finance does not directly impact clinical and clinical does not directly impact finance. Now, I know I've gone over this information very quickly today. And again, the goal was to really increase awareness around different ways that we can start converging quality and finance into a single performance improvement initiative. Now, as Laura had mentioned earlier, again, if you do have any questions, please don't hesitate to reach out to her or you can email me. Again, for organizations, this is oftentimes a new area that they're going to be treading in, and we want to ensure that you have a comprehensive understanding as to how we can leverage these opportunities going forward. So again, I want to thank you for attending today, and I'm going to turn it back over to Laura.
Thank you, Jonathan. Again, folks, if you have any questions, please feel free to reach out. Also, Jonathan did a really great job of touching on benchmarking and the importance of benchmarking. If you would like resources or any data in terms of benchmarking, both quality and finance, please don't hesitate to reach out. With that said, everyone have a great day.